The Enugu State Ministry of Health and Enugu State Primary Healthcare Development Agency, through the support of the Health Policy Research Group, UNN, has formally launched the Urban Health Unit, and this was announced during a press briefing at the State Ministry of Health. The Commissioner for Health, Professor Ikechukwu Obi, spoke on the visit on what this means for the health ecosystem.
Reason from a meeting where we have interacted with our partners, the Health Policy Research Group of University of Nigeria, Nsukka College of Medicine. They have been partnering with the Ministry of Health to be able to set up what they are calling an urban health unit with a target to be able to see how informal healthcare providers can be more formally integrated with the activities of the health sector and health system. So the Health Policy Research Group is looking at the possibility of the Enugu State Health System, increasing coordination, monitoring and interactions with informal health services in the state.
Professor Chinyere Mbechu of the Health Policy Research Group highlighted the terms of reference of the Urban Health Unit.
We are all familiar with the rapid urbanization that is happening in Nigeria, and with the urbanization, there are lots of informal settlements that are springing up, so what we call urban slums. And because these people are living in places that are unplanned, access to health resources as well as all other resources is very limited for them. So we're actually working on a project that is looking at how to make the health system more responsive to the needs of the urban core. And where do we find the urban core? It's in the urban slums. So we've been implementing, we've designed, co-designed or co-created, and we are now implementing a series of interventions to improve access to quality health care for people living in urban slums in Enugu State. And part of what we are doing is to strengthen to strengthen and make it formal. You know, the linkage between informal providers and the formal health sector.
The Executive Chairman of the Enugu State Primary Healthcare Development Agency, Dr. Ifeyinwa Ani Oseku, commended the new unit as a welcome development within the Enugu health value chain.
We are partnering with the Hprg, and the project is known as the Chorus Project. What we hope to do is to understand better what happens in the informal health sector. The informal health sector is a sector that is responsible for providing health services to our people, but not in the orthodox way that you know. For example, you're talking about the traditional birth attendants, the traditional bone setters, and perhaps even the patent medicine vendors. So these are away from the structured health facilities where you have the real private or the public facilities. So this is an attempt to get first-hand data from that sector, which was not available prior to this time. Now, Hprg is supporting us through the State Ministry of Health to get that first-hand data. And as soon as we get that first-hand data, we're then able to interpret it. And from it, we hope to get different kinds of action that will help influence how we improve the health status of our people.
Health Policy Research Group, on behalf of the Ministry Director, Medical Services, Enugu State Ministry of Health, Dr. Sam Igwon, will promise to put the office equipment donated into good use.
Graciously thank you people, the Hprg, for this wonderful gifts and presentations you have given to us for this very, very important project. There's no doubt whether this will make our work much, much easier. it is very obvious that it's going to help us. And I think the outcome of this gift will be seen very soon, because I'm sure we are going to do our best to accomplish the aim and objectives of these presentations.
The high point of the event was the handing over of the office equipment donated by the Hprg.